Welcome to NREMT EMT exam practice test. Our topic today is airway, respiration, and ventilation. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Which is not assessed during the airway management process? A. Breath. B. Heartbeat. C. Skin condition. D. Level of alertness. The correct answer is B. Heartbeat. Explanation. During the airway management process, an assessment may occur by the EMT, visually and by sound, without the patient even realizing it. The EMT should note the patient's work of breath, for example, is the patient's breathing shallow or labored, is the patient grunting, wheezing, etc., skin color and condition, that is pale, flushed, clammy, gray, and level of alertness. Number 2. When should LMA be used? A. When patients have already been on BVM ventilation. B. When patients are in later stages of pregnancy. C. When patients have recently eaten. D. When patients are unable to be positioned properly. The correct answer is D. When patients are unable to be positioned properly. Explanation. The LMA is often an alternative to BVM ventilation and is becoming more common in emergency settings when a more complicated airway issue is present, such as in cases where patients are unable to be positioned properly. It should not be used in patients with an upper airway obstruction. It should be avoided in patients who have already been on BVM ventilation, are in later stages of pregnancy, who have recently eaten, or who are obese. Number 3. What is normal resting respiration of a healthy adult? A. 6 to 10 breaths per minute. B. 10 to 30 breaths per minute. C. 12 to 16 breaths per minute. D. 12 to 35 breaths per minute. The correct answer is C. 12 to 16 breaths per minute. Explanation. Normal resting respiration in healthy adults ranges from 12 to 16 breaths per minute. Elderly adults may breathe anywhere from 10 to 30 times per minute. Respiration rates outside of 12 to 25 breaths per minute for adults under 65 years old is considered abnormal. Number 4. Which is caused when blood oxygen content is insufficient? A. Hypercapnia. B. Hypoxemia. C. Hyperventilation. D. Hypercarbia. The correct answer is B. Hypoxemia. Explanation. Hypoxemia specifically refers to hypoxic situations where blood oxygen content is insufficient. Any cardiovascular dysfunction or obstructions will cause some level of hypoxemia. These contexts can be triggered by neurological issues, such as strokes that affect the control centers in the brain that manage the frequency and depth at which the body respires. Hypoxemia is characterized by dyspnea, chest pain, abdominal pain and contractions, cyanosis, and chronic coughing. Number 5. Which can be caused by infantile respiratory distress syndrome, IRDS? A. Kidney failure. B. Heart failure. C. Liver failure. D. Brain death. The correct answer is A. Kidney failure. Explanation. Infant respiratory distress syndrome, IRDS, is similar to acute respiratory distress syndrome, ARDS, in that it refers to a rapid onset of deteriorating respiratory function, but the condition relates to pediatric patients under the age of 1. Without effective treatment, IRDS can lead to a collapsed lung, hemorrhage, sepsis, blindness, kidney failure, mental retardation, and or cerebral palsy. Number 6. Which part is concerned in upper airway respiratory emergencies? A. Bronchi. B. Mouth. C. Nose. D. Trachea. The correct answer is C. Nose. Explanation. Upper airway respiratory emergencies refer to conditions affecting the nose, the nasal sinuses, and the pharynx. It is unlikely that the emergency medical technician, EMT, will need to diagnose the exact condition causing the emergency, and many upper airway respiratory emergencies present in the same manner and require similar interventions. Number 7. Which of the following is typified by the deterioration of the alveolar walls? A. Emphysema. B. Epiglottitis. C. Chronic bronchitis. D. Foreign body airway obstruction, FBAO. The correct answer is A. Emphysema. Explanation. Emphysema is characterized by the breaking down of the alveolar walls. Once these structures degrade, the excess burden placed on the bronchioles causes them to collapse and obstruct the airway. Number 8. Which of the following oxygen concentrations can nasal cannulas deliver? A. 15%. B. 30%. C. 45%. D. 50%. The correct answer is B. 30%. Explanation. Nasal cannulas deliver oxygen through tubal prongs placed directly into the nostrils at a flow rate ranging from 1 liter to 6 liters of oxygen per minute. This is a lower-level oxygen concentration delivery system, delivering oxygen concentrations between 24% and 44%. They can be used in patients that are experiencing mild respiratory distress but are otherwise alert. Number 9. When is bag valve mask, BVM, ventilation used? A. When the upper airway is blocked. B. When there is risk of aspiration in the patient's mouth. C. When the patient has maxillofacial deformities. D. When the patient's respiratory system fails. The correct answer is D. When the patient's respiratory system fails. Explanation. Bag valve mask, BVM, ventilation is indicated in cases of respiratory failure, when intubation does not work or will not stay, and in cases where both high oxygen flow rate and high levels of oxygen concentration are needed. This intervention is contraindicated if the upper airway is blocked, if the EMT is inexperienced, if there is risk of aspiration or other fluid in the patient's mouth or airway, or if the patient is over 57 years of age, has a beard, is missing teeth, or has maxillofacial deformities. Number 10. The ABCs of first responder treatment is an abbreviation referring to which order of operations? A. Access, breathe, continue. B. Administer, bypass, call. C. Airway, breathing, circulation. D. Airway, bypass, cooperate. The correct answer is C. Airway, breathing, circulation. Explanation. The ABCs of first aid stands for airway, breathing and circulation. The rescuer should follow these steps when attending a respiratory emergency. They should make sure that the airway is open and patent, that the patient is breathing, and that adequate circulation is occurring. If not, those are the steps that need to be addressed immediately. The other options listed do not apply or make sense. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.